It is my pleasure now to present our last speaker. We're going to finish strong. I think we've had a nice collection of presentations and a lot of different aspects that relate to quality of life have been introduced. And now we're going to have a talk that will bring a lot of them together to leave you with specific recommendations to be able to have a better life after a diagnosis of a brain tumor. The next session is titled, How Will My Life Change After a Brain Tumor Diagnosis? And as you know, a brain tumor diagnosis can be overwhelming and have significant impact on your quality of life. By understanding the effects of a brain tumor, patients and caregivers can learn effective strategies to cope with the diagnosis and improve their overall well-being. Our speaker is Dr. Deborah Forst, who is a neuro-oncologist at the Massachusetts General Hospital Cancer Center, an assistant professor of neurology at Harvard Medical School, and associate program director of the Massachusetts General Hospital Dana-Farber Cancer Institute Neuro-Oncology Fellowship Program. She conducts innovative research aimed at designing and testing interventions to support patients with brain tumors and their family caregivers. Deb, we're so lucky to have you here today to share your expertise with our patients and their caregivers, and we look forward to your presentation.
Thank you so much, Nick. It's such a pleasure to be here, and thank you so much to the American Brain Tumor Association for hosting this important program and for inviting me to speak today. There we go. Okay, sorry. I was having trouble advancing my slides. So these are just my financial disclosures, as well as a list of places from where I receive research support, none of which have any kind of pertinent overlap with anything that I'll be talking about today in terms of conflicts, but just so everyone is aware. So whenever someone's giving a talk, they always say that it's important to know your audience. And I think that it's also important and nice to know a little bit about your speaker. So I just kind of wanted to introduce myself. I'm Deb Forst. I am trained, my background, I went to medical school in Texas. I trained as a neurologist first in the Mass General Hospital, Brigham and Women's Hospital Combined Training Program in Boston, which is where I'm located now. I then did neuro-oncology fellowship training, also in Boston at the Mass General Dana-Farber Brigham and Women's Fellowship Program. And for the past about 8 years, I've had my own clinical practice in neuro-oncology at Massachusetts General Hospital. I have a very busy practice. I see a couple hundred individual patients a year. And I also conduct research, and my research, my passion is on developing and testing programs to try to help improve support for patients with brain tumors and their family caregivers in order to improve psychological well-being and overall well-being. And we'll talk about some of those topics today. And so my goals, my plan for this talk are first to talk a little bit about what the impact is of receiving a brain tumor diagnosis, the shock of the diagnosis, adjusting to your new normal, transitioning between phases of care and living with uncertainty. I'll then outline some of the concepts that are important in thinking about how to evaluate support in your life and to optimize support, different types of support, where to find support, and the importance of communication. And then lastly, I'm going to talk a little bit about taking stock of and enhancing your well-being, including managing symptoms and side effects, and ways to try to improve your quality of life after being diagnosed with a brain tumor. And this includes a little bit of a discussion about the different aspects or domains of your well-being, as well as your sense of self and personal growth. Starting with the impact of a brain tumor diagnosis. And so I know that this is a little bit of preaching to the choir, but I think important for us to kind of frame this all by first saying it is earth-shattering and life-changing to be diagnosed with a brain tumor. For everyone who has this happen, it's totally unexpected, and it has a dramatic impact on your life as a whole. And so just some of the things that we have heard in some of our research that patients have told us about what it was like to receive a diagnosis of a brain tumor included patients telling us this all happened so fast. It was pretty overwhelming. All of a sudden, one day I'm hanging out with my kids and a week later I'm in surgery. Other patients said it's all the unknowingness about it, like all the unknowingness of not knowing what's going to happen. And when you normally go to a doctor, they say, do this and it'll make it better. This is like, we don't know how it's going to make you feel. It's going to make you, it's your brain. Another patient said, it just changed me a lot faster. Someone else told us it was such a blur in that time of like finding the tumor, going to treatment, or going to surgery and then going through treatment. And lastly, one patient told us, I feel like when I first got diagnosed, it was terrifying. It took a long time for me to come to terms with what was going on with me and like how, like what my future was going to look like. So I think always helpful for us to kind of think about what other patients have told us and understand the really impactful changes that happen when you receive a brain tumor diagnosis. I also want to highlight that in many ways, you can think of getting the diagnosis of brain tumor as a type of a trauma. And so a lot of research has shown that in patients with all different types of tumors and cancers, that cancer meets the criteria for a traumatic life stressor. It is extremely traumatizing and disruptive to have something like this happen in your life. What are some of the reasons that a brain tumor might be a traumatic experience? So there is physical trauma to the brain and the body resulting from the tumor itself, as well as its treatment, surgery, radiation, chemotherapy. This can result in changes in functioning, including logistical changes. Work may be different. Many patients have issues with driving or are restricted from driving. Household tasks you may not be able to do in the same way. Physical abilities can change. Your ability to communicate may change. And as has been talked about earlier in today's session, cognitive changes, how you think, how you understand things are very common in the setting of having a brain tumor. And all of these things are potentially traumatic for patients and for their families. In addition, as partly discussed by Dr. Logan earlier today, there's really profound emotional and psychological impacts of getting a brain tumor diagnosis. In the early weeks and months after a diagnosis, and also continuing later in one's journey, patients may experience grief, anger, disbelief, and mood symptoms, depression symptoms, anxiety symptoms. I do want to highlight, though, that although you can think of a brain tumor diagnosis as a trauma, it's equally important to know that experiencing the trauma of this diagnosis, while it can cause a lot of mood symptoms and even symptoms of post-traumatic stress disorder or PTSD, not everyone will experience that. And so I mentioned this kind of concept of being a trauma only to explain that you are not alone if this feels like it's been something traumatizing and totally disruptive to receive the diagnosis of a brain tumor. Patients often talk about what it feels like to try to adjust to their new normal. And so patients ask me all the time, is this my new normal? When are things going to go back to normal? Or will things go back to normal? And I would argue that your life is never exactly the same after this diagnosis as it was before the diagnosis. And some of this is because there are a lot of shifts in one's roles after being diagnosed with a brain tumor. So maybe your role in your family might be different. You were the primary breadwinner and now you're not, or you were the carpool driver and now you're not able to do that. Maybe your occupational roles have changed. Maybe there are different things about the activities that you are engaging in now. The things that you can do or the things that you want to do might be different after this diagnosis, and relationships may often change. And we'll talk about that a little bit later. My opinion, and this is an opinion not necessarily supported by research, but by my own experience, is that it's really important to take time to acknowledge and grieve the losses that come with a brain tumor diagnosis. And to me, from what I've witnessed, I think that this is the only way to live through this experience is to really take the time to understand that this is a big deal, to grieve what has happened, and then to figure out kind of how you're going to engage with the world and move forward. I wanted to highlight that transitions in care are times of change and possibly heightened stress for patients and their families. And I'll explain a little bit what I mean by transitions in care. So along sort of the journey of your brain tumor illness, there are many different changes in your care. So there are changes in the importance or role of various medical providers. An example that I think of is in the beginning of your illness, perhaps your neurosurgeon is the person that you interacted with the most and they were really important for a short period of time. And then maybe you have a radiation doctor who for a period of weeks, you're seeing the radiation team every day. You're seeing the radiation doctor maybe once a week or every other week. And then perhaps later, you're not seeing those folks as much, and now you're kind of interacting more with the medical oncology or neuro-oncology team. And those changes can be a little bit unsettling for patients and families. There are also changes in your treatment, the side effects from the treatment, recovery periods, the schedule of visits and tests. Maybe for many people, initially you may have more frequent brain scans and blood tests, and maybe those things become less frequent later on. And then for a lot of people, the period of time when you end a planned treatment, whether that's radiation or chemotherapy, and enter a period of what we call active surveillance, where we're just watching you, maybe seeing you with a picture of your brain, MRI or CAT scan every couple of months, that transition period can feel unsettling for a lot of patients and families. And so they describe that these are times of stress or unease for them. And it's really important, we're going to talk about this later, to tap into all different types of support during these times that can be a time when you feel particularly vulnerable. Living with uncertainty. So we could say that life is filled with uncertainty, but I would argue that after having a brain tumor diagnosis, there's so much uncertainty. It's an inherent part of the brain tumor or brain cancer experience. And part of this uncertainty comes from just the limitations in modern medicine. There is a lot that we don't know and can't know. We don't have a crystal ball. We have results of tests, but we need expert clinicians to interpret those results. And the interpretation can be different between different people at different times in different places. And that can be really confusing. And one of the things that I see often is that what you as a patient are feeling or experiencing, or how you feel like you're doing, or what your family is seeing about how you're doing, may conflict with what we as your care team feel like we're seeing on the diagnostic tests. And some of that is because of sort of the imperfection and limitations of our tests, but it can be very confusing for patients and families. So some of the things that I hear are, I was just diagnosed with a brain tumor. I had a seizure. I had a surgery. I'm doing okay now, and I don't feel sick. And it's hard for me to conceptualize of this idea that I actually have a brain tumor or a brain cancer. Oftentimes I hear, I'm very shocked that my MRI looks okay because I haven't been doing as well. Things are not going as well lately. And that feels upsetting, because why do I feel worse when the doctor is telling me that my imaging looks the same or better? And then the converse is also sometimes true, that patients come in and are feeling great and doing really well. And there's a huge shock that the MRI shows something different. And all of these things kind of perpetuate this feeling of feeling uneasy and uncertain. This can lead to a lot of what ifs, where people are wondering all the time, what if this happens? What if this happens? And catastrophizing, thinking about the worst that could happen. A lot of patients have described to us in our research about feeling like they can't trust their body or themselves. One patient told us that he called this self-auditing. Like he always felt like he had to be checking his own self to kind of see how he was doing. I have a lot of patients tell me, well, I thought maybe something was wrong, but then I tried to do some of those things that you do in the exam. Like I held my arms up and I tried to lift things, and I looked in the mirror to see if my face looked the same on the two sides. And that can be really distressing, to feel like you sort of need to check yourself, or maybe sort of overthinking if you forgot someone's name, or if you couldn't remember something, could that be related to my tumor or to my treatment, or could my tumor be growing back? Lots of uncertainty. And what I'll talk about on the next slides is how this kind of ties into scans. So scans are the pictures that we take of your brain, usually an MRI, sometimes a CAT scan. And this was a cartoon that was actually made by Adam Bessie, who was a patient who had an oligodendroglioma. And I think it's really powerful. He said, living with a brain tumor, sometimes I feel less like a person and more like a scan. And I think that there's a lot of ways to interpret this, but I think that there's this idea that your identity somehow becomes linked to what it shows on your MRI scan. And it's how everybody thinks of how you're doing and kind of assesses how things are going for you. And I think that that's a really hard experience to have. Your scans are only part of, but not the whole picture of how you're doing. And again, they are limited in how much we can say from them. So pseudoprogression is a concept where imaging after having had treatment, any kind of treatment, but especially radiation treatment, can look worse or different and patients can feel worse or different. And all of it can be just related to treatment, not related to tumor growing. But those two things, tumor growth and treatment change or pseudoprogression, are indistinguishable on imaging. We actually are limited in our ability to tell. And that is really hard to kind of sit in that space. Also, what comes with scans is that although I think it's a great advance and it's a legal protection kind of now, that patients have as quick as possible access to all of their medical information, usually through some form of a patient portal. This can be really hard because much of the time my patients actually see their report from their MRI before I've even seen it, and certainly before I've met with them in the clinic, especially if the radiologist sort of put the report out quickly. And this is complicated because radiologists, who are the doctors that look at the pictures of the brain and interpret them, may not have a complete picture of what's going on with you clinically. So what they're saying doesn't always have the full context of where you are in your treatment, what medications you're receiving, when you ended radiation, et cetera. And also, radiologists' job is to report everything that they see. And a lot of it is just a description of what their eyes showed them and may not be clinically important, but results in lots of things being put into the reports that are a cause of distress. So patients will very frequently say, oh, it said this thing about my sinuses or about these changes in my brain, which might be related to age or to a history of blood pressure or to something else that may not have anything to do with the current situation, but can drive a lot of unease. Patients and families, because of all of this, of course, and because it's our way to really kind of assess your response to treatment, place a lot of weight on the scans and the scan results. And this can result in many patients saying they feel like they're living from one scan to the next. Living scan to scan is kind of what I hear. And also an experience of anxiety about the time leading up to the scan, waiting for the results and getting the results. Some people call that scan-anxiety. And so one patient told us, it used to be like a month before my scans, I would be like crazy kind of and super anxious and not really be able to think of anything else. And the scan anxiety would be like for real, like real. So this is a really, really big thing that patients go through. How do you go about living with uncertainty? So I believe that it's really important to figure out what your plan is for coping with and living with uncertainty, a very uncertain time. And this is not going to come overnight, but some things to think about are what has worked for you for challenging situations in the past. Oftentimes, where we draw strength from is something that we can continue to draw strength from when we are faced with new challenges. One technique that the psychologists in our cancer center teach patients that I love and I think is really helpful is, what would you tell a friend? What would you say to someone else in this situation about how to manage this? The reason I think this is so great is because oftentimes we're much kinder to and a little bit better at and more insightful about giving advice to someone else than to do self-talk to our own self. And so I think that this is kind of a helpful trick to say to yourself, like, what would I tell someone else who's going through this? Defining and engaging in valued activities. And what I mean by this is to really think about what's important to me. What do I value? What do I want to do? And to do those things to the extent that you can. Incorporating physical activity and time outdoors. I was so happy that Dr. Gonzalez Castro talked about spending time in nature. I read something interesting recently about how even just being outside for a small piece of time, a small amount of time, can totally shift your mental framework and improve your mental health. And then I would recommend thinking about if there's any, oh, and then, sorry, I skipped one, but meditation, mindfulness, medications when needed are all things that can kind of help with coping. And then think about if there are any logistical modifications that can help. So I encourage you to talk to your team about whether you could do things like, I let my patients, when possible, have an MRI and then come right away afterwards to see me in clinic to go over the results. Might not be possible in your situation for your doctor, for your center where you're being followed or treated. But for some patients, that's a really helpful way to kind of reduce the anxiety that comes with waiting after a test to get the results. Also, my patients who are able to keep themselves from reading the results in the patient portal before meeting with the doctor have found that it's actually really, really helpful to just wait. You can still read the report later and ask questions about it later. But if you can wait until you have an actual human who's taking care of you and who cares about you and who has expertise in this area to go through it with you, Most people find that to be more helpful. There are some, though, for whom that would be harmful because they get an alert on their phone. It says you have a new message in your portal, and they just knowing that it's there is too stressful. And if that's you and it's helpful for you to look, that's okay too. But it's just something to think about. Consider getting formal or professional help. We're going to talk in a little bit about sources of support, and also we'll discuss tapping into your informal support network. So moving on to assessing and optimizing support. A really important thing that I think is helpful for patients when thinking about how are things going in terms of you getting the support or help that you need is to know that there are many different types of support. And many of us, when we hear someone say, I could really use some support, think about the middle column here, emotional or psychological support. So I need some love, encouragement, fun, sharing, talking, warmth, hope, intimacy, validation. But sometimes what you need is practical support, transportation, help with meals, help with household chores or errands, childcare support, financial assistance. There's also informational support. Maybe what you really need is to hear about experiences of other people who've gone through a similar situation. Maybe you need help making decisions or getting more information and education about your disease or about the treatment. Maybe you need more guidance and advice about what to do in a certain situation. All of these are different types of support. And support can come from many different places. So first and foremost, and what is often the most helpful for patients is your existing support system, your family, your friends, your colleagues. This may change after you've been diagnosed with a brain tumor. So maybe you're not going to work anymore and seeing your colleagues every day. And so they're not as much of an important support network for you. Or maybe the people that you could talk to about a work problem are not the people you wanted to talk to about a health problem. And that's all okay. But good to just kind of think about what your support network looks like. Your medical team cares about you. We're here to help you. That's a very important source of support. Professionals, mental health specialists, psychologists, psychiatrists, social workers are an important resource. Many cancer centers, brain tumor clinics, and most hospitals will have embedded social workers who you can be referred to, who can help with practical things as well as with emotional support. Support groups, those exist oftentimes locally and nationally. You may or may not have a specific brain tumor support group near you, but you certainly can tap into sort of the more national resources. And it's not always in person. There are lots of virtual options. One I wanted to highlight is the ABT's Connections, which is a dedicated online support community specifically for brain tumor patients and caregivers. So that's one great option. Patient and peer mentors. I have a lot of patients. We actually have a peer mentoring program in our cancer center. And the ABTA has a patient and caregiver mentor support program. The idea is you get paired up with somebody who is a peer, someone who is another patient or caregiver going through the same or similar experience or having gone through the same or similar experience as you. And I will say that not only are the participants receiving mentorship, finding this to be super beneficial, but I also have patients who have participated as the ABTA patient mentors who said it was so helpful for them and was a way to both give and receive support. So I think that's a great thing to think about. Support can come in the form of rehabilitation therapists, physical, occupational, speech therapy, through advocacy organizations like ABTA and others. And then not to forget yourself, you are a very important source of support. Your own strength and resiliency are something that are really going to kind of carry you through. I want to talk a little bit about getting the support that you need and the importance of communication. And the tip here is, we have learned this from research. This is not widely spoken about. Support that's not helpful, and usually this means that's not matching your needs. So if you need emotional support and people are giving you practical support, as an example, not only is not helpful, but can actually be a burden. And I tell you this to say that if you're feeling this, you are not alone. So these, from research that I did with caregivers of patients with brain tumors, these are some of the things I heard from the caregivers. One caregiver told us the thing that's not helpful is when some people want to help more than we need. Somebody will say, we'll come with you to the doctor's appointment. Well, we really don't need you to come. So it gets awkward saying, no, don't come to an appointment. Thank you for offering. It's very awkward. Another caregiver said, when he first had surgery, I had more food at my home that could have fed 100 people. Food just kept on getting dropped off. I didn't want people to feel bad that I wasn't eating what they gave me. Then that became a chore for me. So that became overwhelming. Other people tell us that initially when they were diagnosed, they got a bunch of support and then it kind of dropped off, and they wished that, people would have asked then what they needed. And then maybe later on, they might have needed to have support that, there was almost too much at first. So it's really important to A, identify what you need, and B, convey your support needs. It's okay to ask for help. It's good to ask for help. And people who care about you really want to help, but they are not mind readers. So you have to tell people what it is you need. If everybody is bringing food and your freezer's overflowing, and what you really needed was help figuring out how to pick up your child from daycare, you need to actually tell people that. And there are ways to do that. And just remember that your needs may evolve over time. What you need today may not be what you need in an hour or tomorrow or next week or next month or next year, and that's okay too. I wanted to just give you one technique that I have learned from our cancer center psychologists about using assertive communication, which is something I think that you can use throughout life, but particularly when you're asking for support or when you're trying to talk to somebody about how support that's being given or something that's being done might not be helping. And the idea of this is that this is a way that you can actually ask for what you need in a way that's less likely to leave the other person feeling hurt or offended, but is expressing what your needs are. And this technique is called the 3 Fs, and it's a statement of fact, a statement of feeling, and a statement of fair request. So fact is you describe the situation. When I see this, when I hear this, when you drop off food, etc. Then you say the feeling. I feel, and you can say whatever you feel. The nice thing about this is you're saying how you feel, not it's disrespectful that you're doing this, or, kind of putting the other person on the defensive. And then a fair request. What would be more helpful? What would you like instead? So I used a very simplified example of something that I could use in my own house with the 3 Fs, which is when I notice that fact, you throw dirty clothes on the floor instead of in the laundry hamper. I feel sad and frustrated because I'm working really hard to keep the house clean. And when I come home from work, I just want your bedroom to be clean. And the fair request is, I would really like if you could put your dirty clothes into the hamper in the corner of the room. So this is just an example of one thing you can think about in terms of assertive communication. And finally, for the last part of the talk, I want to talk about taking stock of and enhancing your well-being, managing symptoms and side effects, and improving your quality of life, including domains of well-being and sense of self and personal growth. So this is what I believe to be a really lovely figure that was developed by one of my colleagues, Dr. Lara Traeger, who is a psychologist who focuses on psycho-oncology. So she conducts, she focuses her psychology research and care on patients with cancer and tumors. She's located at Mass General as well as a dual appointment at the University of Miami. And the idea is that your self is kind of in the center, and there are all these pieces around the outside that are different aspects of your well-being. How well are you doing? Physically, functionally, emotionally, relationship-wise. And we're going to talk about some of these. For each of these, actually, we're going to talk about all of them, but for each of them, I'm going to just briefly touch on my recommendation for you to take stock of, take your pulse, take your vital signs, as we say in medicine, each of these areas at some point in your journey with your brain tumor. And just pause, take a moment, think, how am I doing in this aspect of my life? And then I'm going to give you some food for thought about how you might improve those areas. So physical well-being, how's your energy level? Fatigue is the #1 symptom in brain tumor patients. #2 is sleepiness or drowsiness. #4 is disrupted sleep. So patients with brain tumors are tired. Are you tired? Are you acknowledging that? Are you seeking help for that? What active symptoms are you having? Nausea, constipation, headaches, other symptoms. Are you having seizures? How well controlled are your seizures? Any medication side effects? How's your overall strength and conditioning? Any vision changes? And then what about your overall health? Is your diabetes flaring up? How's your blood pressure control been? Are you having heart palpitations, racing heart that you haven't talked to anybody about, leg swelling, some other thing that's going on that you're worried about? All really important. And then how do you optimize your physical health? #1, talk to us, your medical team, about your symptoms and concerns. We've talked a lot about exercise today. Fully believe in the importance of this. Move your body if and when you can. Take care of your overall health. Patients ask me all the time, do I really need to have a primary care doctor? Is it that important? Should I even bother going to the dentist anymore now that I was diagnosed with a brain tumor or getting my eyes checked? Yes. And maybe you need to delay those appointments during the time when your treatment is very burdensome. If you're getting radiation every day, maybe that's not the time. You want to push off the eye doctor visit by a couple weeks or a month. But yes, all of those things are very important and can make you feel better as a human overall. Physical therapy and occupational therapy can be very, very helpful for your physical well-being and getting good sleep and good nutrition. How about functional well-being? How are you functioning? How is your mobility? Can you move around? Are there limitations there? Your balance and coordination, what we call gross motor skills, how you're kind of moving the large parts of your body, and fine motor skills. How are you able to do more intricate things like with your hands? Knitting or crocheting would be a fine motor skill. Buttoning a button is a fine motor skill. Communication, are you having trouble with your speech? Is your speech slurred? Are you having a hard time with language, like thinking of words or understanding words other people are saying? And all of these things play into how able are you to perform activities that you want to do. Driving, hobbies, leisure activities, travel, if that's something that you like, I think is a really wonderful thing for patients with brain tumors to do. All areas to kind of ask yourself, is this something I want to do that I'm not doing? And work. And then find ways to optimize your functioning. And again, I appreciate so much all of the things that have been talked about by Dr. Gonzalez Castro and others. Exercise and movement, same thing that you kind of heard in the immediately preceding talk about starting low and going slow to improve your strength and conditioning. Formal rehabilitation efforts through speech therapy, occupational therapy, physical therapy, cognitive rehabilitation, and even considering for some people consulting with a doctor who is trained in what's called physical medicine and rehabilitation. These are doctors whose expertise is after an injury, and a brain tumor is a type of an injury to your brain, how to optimize your rehabilitation. I also recommend thinking about if driving is a concern for you and could be a possibility, doing a driving safety evaluation, which is often done by occupational therapists, and considering if there's anything that can be done, including adaptive equipment, to help some patients, not everyone, return to safe driving. So for instance, I have a patient whose right leg was weak because of his tumor, and now he was able to do a driving safety evaluation and work to get hand controls for that actually are kind of attached near the steering wheel and operate the brake and gas pedal, and helped him to be able to return to driving. And then manage changes in your ability to engage in your work and leisure activities, not only exploring adaptations that might help you participate. So maybe I can't type at work anymore, but my company can get me a headset with voice recognition software so I can dictate all of my emails. That's an example of an adaptation that until you explore it, you might not know is even an option for you. And consider that how you participate in things may look different than before. I really encourage patients to try to avoid all or none thinking. An example of all or none thinking is something like this. If I can't ski like I did before, I might as well not go on the trip at all or none. And instead consider what might be enjoyable or might be good enough, even if it's not the same as it was. So what if you could say, you know, one of the things I really enjoy is the time when I'm sitting in the lodge, drinking hot chocolate and watching the snow falling, or I love cooking chili after the ski day and playing a board game with my family in our rental condo. What if you engaged in those things, even if you couldn't do the skiing? For most people, that would be better than not going at all. And it's so hard, easy to say, so hard to do, but something I would encourage people to think about. And then if there's something that you liked, let's say you loved crocheting and you can't do it because your hands don't work the same way that they did before your diagnosis, can you think about what you liked about it and find something new to explore? Maybe I really love creating beautiful things. And so now I'm going to do abstract art painting, and I'm going to get myself a canvas and just kind of explore whether that's something I like. So that's one thing that you could think about doing. A few other things to touch on: relational well-being. How are your relationships going? Your communication and engagement with key people in your life, friends, family, neighbors, acquaintances, employer, coworkers. Changes in relationships, as we've mentioned a little bit before, can result from change in your role in the family. A lot of people's interests and priorities can shift when they've been diagnosed with tumor or cancer. wanting to protect or shield your loved ones. Maybe your relationship's different because you're not saying all the things that you're thinking or feeling to try to protect people you care about. Your expectations of yourself and what you think other people expect of you, changes in physical intimacy, and just the stress and trauma of the diagnosis for you and for the people around you. Some things to think about are to work on communication. I give you one example of one type of communication technique. You might like it, you might not, but think about ways to enhance communication with loved ones. Set boundaries and limits. It's okay to say, a lot of people feel this way, I don't want to talk about my health anymore. I want to talk about something else. Remember that you control the information, including who, what, how, and when you want to talk about things. A lot of people report that they feel burdened by everybody wanting an update. So they go to their visit and then 10 people are waiting with bated breath to hear what the doctor said. If that's something that's going on for you, think about having a point person in the family. My son, Michael, is going to be the person who maintains the group text. He came with me to the visit afterwards. He's going to just send a quick note to let everyone know this is what the doctor said. If that's a way to sort of take some stress or burden off of you, that's a great thing to do. Vocalize your needs, let people know when you need extra physical space or you're having symptoms. I need to rest. I need a minute because it takes me longer these days to get my thoughts together. Reconnect with people you care about, engage with loved ones, even if it's different than before. Make time to do those things. Recharge, make time for your own self-care and your loved one's self-care. All really important ways to improve relationships. Thinking and cognition talked about a lot by Dr. Hervey Jumper, who's so wonderful. Just wanted to reiterate that this is really common, that because of the brain tumor and its treatment, you may have changes in your thinking and memory. If this is an area of concern for you, think about what you can do to help in this area. Consider having a formal evaluation by a neuropsychologist like Dr. Logan, who can help assess what your areas of relative strengths and weaknesses are in terms of your memory and thinking, and figure out an action plan. One patient told us, basically, I have to write things down. If I have 3 or 4 things to do, I do 2 of them. I have to really sit and think what the third and fourth things were to do. In addition to writing things down, there are many other strategies that can help improve cognitive performance, cognitive rehabilitation, exercise, talking to your doctor to see if there's anything to check for, like maybe your thyroid or other hormone levels are off. Maybe your diet has changed and you have some kind of a vitamin deficiency. There are some things that are medical things that actually also affect your thinking that you might want to think about. And in selected cases, for some patients, prescription medications like stimulants, which are medications used to treat usually ADD or ADHD, and dementia medications can be very helpful for some patients. Existential or spiritual well-being. So existential issues or questions are questions related to our existence as human beings and how we find meaning, purpose, satisfaction in life, and how people make meaning and find purpose in their lives can change at different points in their lives. And being diagnosed with a brain tumor can really trigger what we call existential distress, where people feel upset by all of this and thinking about these big life thoughts. A related concept, but not always overlapping, is spirituality. Spirituality is the idea or belief that there's something bigger than us, something that transcends our human experience. For some people, that's part of religion. For others, it's not. And we know that spiritual distress is commonly described when people are diagnosed with a brain tumor and can have negative effects on quality of life, on coping, and on your overall health. These are very individual, personal feelings and experiences. These are important for some people, not as important for other people. If religion or spirituality are important for you, it may shape your medical care decisions, and is important to feel empowered to talk about it with your medical care team, and also to try to seek support, whether from, sort of organized religion or not, spiritual leaders, hospital chaplains, wherever you can find support for this. This is an important kind of piece of yourself to attend to. And then the last piece in this circle is emotional well-being. You may experience a wide range of positive and negative emotions after a brain tumor diagnosis. Patients describe feeling fear, anger, gratitude, sadness or despair, hope, loneliness, an overwhelmed feeling, and guilt. One patient said, right now, I feel super kind of stressed about the financial piece and having my family be okay and taken care of. That piece hits me really hard. And then figure out Remember, these are normal experiences. It's important to acknowledge your feelings. I tell patients it's okay to be sad about sad things and upset about upsetting things. And then develop strategies that help you cope. Sometimes you may need a professional to figure out how to cope. That's okay. That's good. Combination of some of these things are just ideas that may help with your emotional well-being. Let your feelings out. Feel your feelings, share your feelings, tap into the support like we discussed, find ways to relax, get outside, move your body. Try to focus on, so hard to do this, controlling the things you can control and not focusing on the things that you can't control as much. Do the things that are important and meaningful to you. One patient told us, I think the writing's been most therapeutic for me. So that was something that they tapped into to kind of help. And at the center of all of this is yourself, your identity. How might your identity change after a brain tumor diagnosis? Patients with a brain tumor often report that the way that they feel about themselves is different. This is common in patients with lots of cancers and tumors that are not in the brain, but can incorporate a lot of different things, including changes in your perspective and priorities after kind of getting through the shock of the brain tumor diagnosis. A lot of people say what's important to me is different than it was now. So I feel different. Your physical appearance might change. Maybe the surgery or the radiation makes you look different. And unique challenges, maybe not experienced by other tumors or cancers, by patients with other tumors or cancers that are specific to brain tumors, include effects of the cancer itself on emotion, behavior, thinking, personality, and your physical abilities. Who you see in the mirror might look different to you. And a lot of times there is distress that's related to the change in how you perceive yourself and what are frequently negative comparisons between how you are now and how you think you should be, or how you think you ideally want to be, or how you used to be before your diagnosis. And those kinds of comparisons are natural, but can be hard and can really lead to making you feel upset, down, worried. There's no easy fix, but again, I really, really, really emphasize taking the time to grieve the losses that have happened because of this, practicing patience and self-compassion, taking care of your body and your mind, revisiting your values and priorities and trying to do the things that matter to you, seeking help, whether it is on an informal level or a professional level. And one tip that our psychologists use that I really like is shake things up, do something different, go somewhere new, try a new food, listen to a new song. For a lot of people, that actually helps them almost reconnect with themselves. And I really love that suggestion. And I want to end, I'm not a big person on cliches, but I actually really like thinking about this, that when you are diagnosed with a brain tumor, it puts a lot of cracks in the foundation of everything about your life. But beautiful things often grow from cracks in the sidewalk. And while many people have heard of post-traumatic stress disorder, what a lot of people don't know about is post-traumatic growth. And this has been very well described in patients who've gone through all different types of trauma, but especially after a tumor or cancer diagnosis, is that the silver lining, if you will, the beauty, the change that can come that's positive is what's called post-traumatic growth. And people may experience improvements in their personal strength. They feel more resilient, more humble, more authentic. There are new possibilities, new interests, adaptability, learning that you can adapt to different things, that you can live and work differently than before. Improvement in relationships. People describe increased emotional vulnerability that they maybe weren't showing before, stronger bonds with loved ones, spiritual growth, development of sort of deeper, more meaningful beliefs, deeper faith, clearer purpose, and overall just appreciation for life, increased gratitude, a clear sense of priorities, and appreciation for the things that are good. And I just wanted to leave you with this to think about, that there are beautiful things that can grow out of the cracks, and there are positive things that can happen and growth that can happen, even in the setting of something that's so disruptive. Thank you so much for your time and attention. I look forward to and welcome any questions that you might have.
Thank you so much, Dr. Forst, for a wonderful presentation and for that very nice message at the end, that we can grow even out of the most significant challenges in our lives. We have a few questions on the Q&A, and this question, I emphasize again that it's difficult for us to provide specific patient advice through this forum, and specific questions can only be answered by the direct providers of each patient. But I think there are some things that we can discuss here. This is a patient that is experiencing seizures as memory gaps, and if you are aware of this, and then about the use of an AED, an anti-epileptic drug, that was prescribed to this patient, and then the need to continue on treatment indefinitely. So perhaps you can provide your perspective in terms of how seizures can present in different ways, and your approach to treatment.
Yeah, no, absolutely, absolutely. So thanks so much for this question. I was just looking at the question in the chat as well. And I'm sorry for the patient who's experiencing this. So seizures are really hard. They're really hard because they're very disruptive. The very nature of seizures is that disruptive in a lot of ways, but the seizure itself kind of interrupts what you're doing. Disruptive because the worry about having another one is there and is real and is strong. And disruptive because there is the worry that a lot of times the very nature of the seizure can be that it disrupts your ability to even know that it's happening. So patients feel like, I didn't even know that I had a seizure. I don't remember having it. I was just told that I had sort of this, blank out or memory lapse. Seizures can look very different for different people. And we humans are not very good at detecting when someone's having a seizure unless it's really obvious. If someone loses consciousness and their whole body is shaking and jerking, we know. But there are lots of symptoms that could be a seizure. And sometimes we have to do things like monitoring with what's called an EEG, electroencephalogram, where they put the stickers on your head with wires and monitor your brain waves, a brainwave test. And even then, unless we actually capture you having one of these episodes, we don't know if you're having a seizure. Without being able to give specific advice for a specific person, which would best come from their doctor, I will say that when thinking about medications and the effects of the medication and being on the medication and how long, the general thinking is that we know brain tumors increase the risk of having seizures, that seizures can happen at any time along the course of the illness, but that a lot of research and thought has gone into this. And we think that for most people, it doesn't make sense to be on a preventative medicine against seizures unless you have had a seizure or an episode concerning for one, or if there's some other reason your doctor thinks that you need to. Sometimes around the time of surgery is the time we do it. And then the decision of whether and when you might be able to come off of an anti-seizure medication is a very, very, very hard one. And there are lots of different thoughts about this. I think about this a lot as a risk-benefit trade-off. The seizure medications that we use, most of them are very, very safe, even in the long term. And so what it comes down to is, are you having side effects that are really problematic? Are you having seizures or not? And what is the risk of you having a seizure if you come off of the medication? And is it worth doing that because you're having such serious debility or side effects from the medication? Or is it worth it to take what I usually prefer, but I'm pretty conservative about these things, the less risky path of just, if it's potentially keeping you from having more seizures, stay on the medication? Because even if your seizures were something small, like a brief lapse in time or memory, they could turn into something bigger if you weren't on a medication. So it's kind of a long answer. It's very complicated, and there are lots of different things to consider.
Thank you so much for providing that perspective. Yes, the participant added that he had an EEG and it was inconclusive, which is not an uncommon situation, and we understand the frustration and the uncertainty that many of these patients experience. There's another question. There's more of a statement. It's a patient that notes that had 3 craniotomies and experiencing a visual field cut and cannot drive. I was working now, but I am not. It has been 10 years and I'm still struggling with the loss of my identity. Any thoughts or reflection of that? And you mentioned driving as an impairment as a result of having had a seizure, but also loss of visual field can lead to inability to drive.
Yeah, yeah. So thank you to Jen for your vulnerability and honesty and sharing your experience. And I'm sorry to hear about your experience. This is so, so, so hard. I just want to say that you are not alone, that not being able to drive. So I just had a full clinic yesterday, and there is a patient where it just breaks my heart because he has a field cut from his tumor. And he keeps hoping that it's going to get better. We're worried it might not. And he and his wife were sharing how much the inability to safely drive has affected him because he feels that his independence has been taken away. And independence is a big part of our identity, right? When you graduate from a child, teenager, adolescent to being an adult, the big thing everyone values is their independence. And in the United States of America, where we're sadly not like some countries where public transportation, maybe you live somewhere where it's a little better, but in Boston, public transportation so. We rely on our ability to actually get in and operate an automobile. And that's really, really hard. And I just wanted to acknowledge how hard that is, and that this is such a common experience among our patients. Um, and I think, an area for us to think about in terms of improving quality of life for patients who are going through brain tumors is ways to help people to sort of, find new ways to be independent, and offering resources for people to be able to get to the places that they want to go so that that piece doesn't feel lost. And the struggle with loss of identity is really so hard. And I just am appreciative of you for sharing that.
I would also add, because after Dr. Herbie Jumper's presentation, there was a question that came in last minute about recovery from a visual field loss. And it's a tricky situation because oftentimes after an operation, there's edema, there's swelling in the area of the resection, if this affected areas in the posterior part of the brain, and there could be some recovery afterwards. But my recommendation would be for patients to have their visual function formally evaluated by an ophthalmologist or neuro-ophthalmologist that would map your entire visual field. And that would be a specific way that you'll be able to see if there's an improvement down the line. And, recovery varies and is essentially a function of what is causing the deficit. If it's, a structural issue after the resection, or perhaps some swelling that could improve. We have another question. It's a comment recommending a book on the ABTA website, What My Brain Has Taught Me. There's a participant that is strongly recommending that as a good resource for patients and caregivers. There's another question. How do you deal with the anxiety of watch and wait? What is your approach? This is a patient that is mentioning she has a specific brain tumor diagnosis, as well as risk factors for other tumors, but you mentioned a number of things in terms of managing anxiety of what's going to come next. What specific recommendations do you usually go back over with your patients?
Yeah. So I really hear this in my experiences as a provider, and also just as a human. I'm a worrier, and I'm a very impatient person. And so watch and wait is a really, really, really hard thing to do. I think again, kind of just to reiterate, finding and tapping into the things that help you to be calm in the setting of things that are distressing, just to acknowledge that it is stressful to be in watch and wait. And that what most people experience is that there's kind of a roller coaster, but that, the time leading up to the scan is stressful. You get the scan and feel better. And then hopefully there's a period of time where you don't feel as worried about it. Many people also say that the further along they get in watch and wait, that this dissipates a little, that things kind of settle down, and that it tends to feel a little bit better. But I think tapping into the things that help to get your mind engaged in doing other things, activities you like to do, exercising is a really good, changes the chemicals in your brain and makes you feel better. We know that for a fact. We know that over time it lessens anxiety. So I recommend that for patients when it's possible to exercise. Not everybody can do vigorous endorphin releasing physical activity. You can eat chocolate that also releases endorphins, but I think just sometimes just acknowledging to yourself and being patient with yourself that this is normal to feel anxious, but also that I'm going to trust in my care team and I'm going to try to live my life as best as I can in between the scans and know that I may not be able to get rid of the time that I'm getting the picture of my brain taken as being a stressful time. And that to some degree is okay too.
Thank you. There are a couple of comments. Obviously, the content of your presentation has resonated with many of the participants, and they're all very grateful for everything that you have presented and discussed. And I think that we're a little bit behind schedule, so we'll wrap it up here. I want to thank you so much, Dr. Forst, for joining us today and for a wonderful presentation. We have shared patients in the past, and you're a wonderful clinician and one that really addresses all the aspects that patients need help with. And you definitely check all the boxes, and your patients are lucky to have you. And today, through the efforts of the ABTA, a number of other patients have been able to benefit from your expertise and your compassion. So thank you again for joining.
Thank you so much for having me.
Yes, I echo what Dr. Gonzalez Castro just said. Thank you so much, Dr. Forst, for being with us today and wrapping up this program so eloquently. Well, all right, everybody. Thank you so much for your time. This now concludes the ABTA's patient and family meeting, how to improve quality of life while living with a brain tumor. As a reminder, today's meeting has been recorded and we will send it out later next week with some helpful resources. I know Director of Patient Services, Mindy, just sent the link to that book. Thank you so much, Regina, for recommending that book. Feel free to check it out. We will be also sending some additional resources from today's meeting to each of you. So feel free to check your emails next week. But before we officially go, we would like to have each of you respond to this last poll to understand if our program was beneficial to you. So for those of you who are still on, we're going to ask this last question. So the statement is, I have a better understanding of tips and tools that may help to improve my quality of life. See some responses coming in. And obviously we understand everyone's at different levels. They might be in the new stages, the later stages of diagnosis. So there's no right or wrong answer. All right, just a few more seconds. 3, 2, 1. Wonderful. Well, we have a lot of people that shared that they have agreed or strongly agreed that they have gained some tips and tools. We are really grateful for each of you being here and hope that you found this information to be informative and continue to inform as we share the information post-event. We invite each of you to continue to stay connected with ABTA through our programs, our resources, and services. Visit us at abta.org and sign up for our monthly newsletter, Mind Matters, or connect with us with the ABTA through any other social media channels. We also encourage you to take a few minutes to complete a brief survey to evaluate today's meeting. Take out your phone, go to the camera, and hover over that QR code, and the survey will pop up. I'm also going to send it here in the chat as well, the survey link, and it will also come in an email with the survey link as well. Your feedback is really important for us as we plan for future programs. So please share honestly what you would like to see at our next meeting. Additionally, I would like to just thank all of our speakers and, of course, our chair, Dr. Luis Nicholas Gonzalez Castro. That's a beautiful long name. And we just thank you so much for all of your time and effort and leadership in putting together this incredible and well thought out program. I invite you to say a few closing remarks.
Thank you, Emily. I renamed myself Nick on the chat to make it easier for everyone. But I want to thank all the participants that joined us today, patients and caregivers and folks that just want to learn more about brain tumors and about how to live with them. Obviously, as it was mentioned by many of our speakers, the diagnosis of a brain tumor is a life-changing event. But life has changed and it can go on, and it can go on well and with wellness. And with that goal is that we prepare the program today for you, and I'm encouraged by the fact that many of you find it helpful, and I hope that other folks that will be benefiting from it when it's posted online will find it helpful as well. I want to thank our terrific speakers, Dr. Ashley Lowen, Dr. Sean Hervey-Jumper, and Dr. Deborah Forst for joining us today, for dedicating a significant amount of time in preparation prior to today's program, and for joining us live today and answering questions, as well as Dr. Lowen's patient, Ali, who was terrific and really gave a wonderful perspective. I want to build on something that Ali shared with us about searching for information online. There are good resources out there, and there are many of the other ones. And if you want to learn more about brain tumors and brain tumor care and support for brain tumor patients, I encourage you to go to the ABTA's website, as all the resources there are carefully prepared and designed and have appropriate and valid information that will help you throughout your journey. Lastly, I want to thank you, Emily, and the rest of the team at the ABTA for helping organize the whole program. And I look forward to being of help in the future with other initiatives. So thank you so much, everyone. And I give it back to you, Emily.
Thank you so much. And thank you for those kind remarks. It's really been an honor to work with you. I would also like to thank our funders and sponsors, Genentech and I'm Matt Vax, for their support of this meeting. Without the time and effort from each of these individuals, organizations, speakers, we would not be able to bring you this quality educational programming. I would also like to thank my team, my Director of Patient Services, Mindy, and also my colleague, Ambreen, for all their support for this incredible meeting. And most importantly, I want to thank each of you. Thank you so much for taking time out of your Saturday to be with us, for joining this community. And we hope you found our meeting to be full of new information, resources, and support. Some upcoming events, if any of you are interested, we have a webinar coming up in July called The Latest and Greatest in Brain Tumor Research, taking place July 9th. And additionally, registration is now open for our national conference taking place here, where we are headquartered in Chicago, and also online. Thank you again so much, and enjoy the rest of your weekend. Take care.